joining us now is Associate Professor Taipapaki Elana Curtis, Director, Taikura Consultants Limited and Oronuku Limited, and Dr. Rawiri McCree Jansen, GP and Chief Clinical Officer, Te Whatu Ora, Iwi Māori Partnership Board. E aku rangatira tēnā kōrua, no mai. Thank you both very much for joining us. Okay, we've seen Rawani's story. E pēhana ngā whakaaro. Rawiri?
Yeah, look, really appreciate the story. I think, you know, if I was thinking about the Whakatāne community, I would be worried about that. You know, they're really going to have a service which is missing part of what they need. I acknowledge that the midwifery services that are there are probably going to carry on doing a fantastic job, but for those who need the additional intervention, this will be a concern. Midwives are going to have to make that call reasonably early if it's going to need an epidural, if it's going to need somebody to be taken to Tauranga, if it's an emergency caesarean. And so those things are going to be, I think, troubling for the community and for hapu mama.
Yeah, no, I totally agree. You know, we need to be doing way more for our Māori communities, not less. This is Whakatāne, this is the Bay of Plenty, this is a really high proportion community of Māori in that community, and yet we're actually doing less, and we're not getting it sorted for them to make sure there are the clinicians. Now, it's not intentional, but it's actually not good enough.
And when you take into consideration the whole rohe, you know, wharekahika, all the way down, the word that comes to mind is risk, and there seems to be a lot of fear in the community as well, Rawiri. So how do we deal with that? Because there are hapu mama thinking now, oh my gosh, what happens if something goes wrong?
Yeah, sure. And there'll be several parts of the solution to that. But one of the solutions needed to start about 6 years ago when we started, you know, developing our own ONG specialists and recruiting them and bringing them into Whakatāne. And Whakatāne must be a fantastic place to be a specialist. But right now, with, you know, that shortage, significant issue for the community. And I really want them to feel that they're going to get the service they need. Important that we hold Cath to account on that and say, yep, we definitely want this recruitment to work and we need it now.
Cath also said something which was interesting about there wasn't consultation with the community, particularly a high Māori population community. Shouldn't that actually be the first thing that happens in this kind of process?
Yeah, having community voice is absolutely important because we need to know what the community's needs are and what their desires are, what their tino rangatiratanga is over their own healthcare and how they want it delivered. Yeah, it's just not orientated towards allowing Māori whānau community voice into the decision table. It's really hard to get there as a policymaker and as anyone giving advice on Māori health at the moment. But yeah, not having the community voice is equally problematic as well.
This disconnection thing comes to mind, right? I mean, Ned Tanchell's mentioned it, is that there's people making decisions outside of communities about these communities. Is that disconnection real, Rawiri?
Yeah, look, I think about Tū Whareto, and we're also facing some issues there in terms of recruiting the workforce that we need. So managing that does mean that we have to engage with the community, have upfront, honest communications like Cath was doing, albeit there's this bit that was missed perhaps earlier. That's an important conversation. I think whānau communities do need to know what's going on, what the solution is and how they're going to get there. Otherwise, you're going to lose trust, so it's important.
Do you trust when Cath says, and Whatu Ora is saying, yep, they're working on it, they're recruiting, it's going to be a year, maybe. Do you think that's actually going to happen?
Yeah, I do. I think it's definitely in Whatu Ora's interest to do a great job of recruiting to that. It's not a long-term solution to have it all farmed out to Tauranga, and she said it very publicly. I think she said it in a way that we should be able to hold her to account and make sure that we get to the right place.
We saw some amazing work on the community bus service. Taipapaki. Is that solving the problem, or is that just solving a symptom of the problem, in your view?
Oh, that is so...
Go for it.
The problem's so big, Julian.
Yeah.
So it's awesome, right? And just mihi atu Tawa and the amazing work that she does down on that bus. But it's just one little component of the whole pathway of health, and it's not enough. Like, we have to do the stuff before people need the bus. Then we have to do stuff after the bus, which includes hospital services and actually being able to deliver culturally safe, racist-free treaty compliant and pro-equity interventions, not just at the bus in the community. The whole pathway needs to be sorted out for Māori.
How do we do so? And I know this is a huge question about how we do that, but it feels like communities value the services that they have, particularly around mobile bus services and things like that. How do we therefore increase the confidence that communities can have so that they're not just relying on the community bus service that comes around maybe once a week, and that's if the bus doesn't break down or other things happen, right?
Oh, it's really reforming the whole health sector to actually be focused on equity. And what we've got at the moment is political sort of environment, which is doing exactly the opposite. Yeah. And it needs to stop, because we actually deserve way more as Māori for our health outcomes.
Do we, look, this is a question for both of you, but particularly for you, Taupapaki, do we appropriately value and prioritise maternity care in the health of our wahine Māori, or not?
Oh, well, I just looked to our data, which tells me that Māori wahine are less likely to have a lead maternity carer than non-Māori in their first trimester. Then when they've had their pepe, they're less likely to be enrolled in a primary health care setting, which is really, really important when you've just had a new baby. Not to mention everything else you could be wrapping around these whānau at the same time, such an important time. So I'm worried for our Māori mama and everything. And then to have this on top of it, and now not even a service for a really important area like Whakatāne, it's just like whammy after whammy after whammy, hitting us while we're down when we actually need way, way more, and we need it done so much better.
Rawiri, lack of specialists is an issue. It's not just in Whakatāne. Where are they going? Or what's happening? Are they all going to Australia?
Oh, well, internationally we can see that, doctors are being drawn to those places that pay more, and we're no exception to that. We're trying to recruit doctors from around the world to bring them from other jurisdictions here to fill our gaps. That's a problem. I think grow your own is the real correct answer. Yeah. And it's important that we acknowledge the government's announced more training places for doctors, med students around, that's good. And we need more training for nurses. We've got to have more nurses in communities and, all of the health professionals. We've got to solve all of these problems in the health system.
What did you both make of the government's decision to lower the age of bowel screening across the board, but to do so by scrapping the funding that targeted Māori and Pasifika whānau at the age of 50?
I might even get a bit emotional about this one. The potential to benefit has been removed for Māori. And the potential to benefit from a screening program, because you haven't lowered the age range, where over 50% of all the cancers in bowel are happening for Māori. It's deliberate. To do that and basically to privilege Pākehā in their bowel cancer screening over Māori and Pacific, I can't explain to you how angry I am, because it's so unevidence-based. It's so unethical. It's just so wrong.
The evidence is there that shows them that by undertaking a decision like this, Taupapaki, that there are going to be massive impacts on whānau Māori. Is that what you are saying? Absolutely.
If there's one little thing out there at the moment that we had the best quality evidence-based, not just using ethnicity as a proxy, which is valid and reasonable at times, for need. We actually have the actual data that shows the need, that shows the distribution of where we develop our bowel cancer. It is between the age of 50 to 60. So when you don't allow Māori to be screened at those earlier ages, you're effectively saying those lives don't matter. That bowel cancer doesn't matter. We're actually going to privilege where the Pākehā bowel cancer starts, and that's from age 60 onwards. We're going to drop it down a little bit more. You're going to save Pākehā lives with that drop, and you're going to exclude Māori, exclude Pacific from the potential to benefit. That is very unethical. I can't even begin to explain that, but I'll let Rawiri continue.
Yeah, just practically, half of all Māori bowel cancers occur before the age of 60. If we're going to have a national bowel screening program that works for Māori communities, we have to start at age 50. And to take the money off that program to get everybody down 2 years, I don't think anybody's going to feel great about that. I don't think Pākehā New Zealand feels that's the right thing to do. I think they're going to feel stink about it, and we're getting ripped off. We're going to talk about hundreds of Māori bowel cancer deaths that are avoidable, preventable, and this government's going, those lives don't matter enough.
What the government will say in response is they'll say, we're focusing on equality. Right? They're saying all New Zealanders, right? They're saying equality over what sounds like equity, What is your response to that? Because that seems to be the policy approach and directive.
But half of all Māori bowel cancers occur before the age of 60. You're delivering a bowel cancer program that doesn't work for Māori communities. That ain't right. It's equality, but it's not right.
Well, I disagree. I don't
not-
even think
it's
it is
not even
equality, actually, because you're actually privileging Pākehā bowel cancer outcomes over Māori. So what you're doing there is you're actually not behaving equally for Māori and Pākehā. You're actually giving Pākehā a much better step up in terms of bowel cancer. You're privileging Pākehā lives, and you are actually doing the opposite of what you should be doing for Māori and Pacific. It's not equal, definitely not equal, and it's not equitable.
Let's go in. You're burning trust.
Yeah.
If you're the health system health minister, you want to be trusted, then be trustworthy. You know, that's the starting point.
Yeah, be evidence-based. Come on, this is the cornerstone
I was going to say
of
about the
medical
evidence-based, but
practice.
in the data that is there.
Evidence-based medicine.
Okay, I was going to ask you about whether or not Māori health inequity is at crisis point. But the better question actually might be, we're worse than a crisis point, potentially. Are we? Māori health is at crisis point, isn't it?
Look, Māori health has been at crisis point for as long as I've been a public health physician in health, and probably way before then, and probably still going to carry on afterwards, unless we do a fundamental shift and actually reorientate healthcare, the health system, to actually care about Māori lives and to care about equity outcomes. It's got to change how it goes about doing its business.
Well, Māori communities will say we had that with Te Whatu Ora. And the Labour leader, if he becomes Prime Minister, has said he probably won't look at bringing that back again if they become the government. So what do we do now, Rawiri?
Well, I'm a glass half full guy, right? Yeah, Māori life expectancy is improving. The gap's not improving. We've got more to do, and we've got to do a much better job in terms of cancer. We've got to do a much better job in primary care. We've got to do a much better job in terms of the social determinants of health. So, there's some great programs like housing and, making sure that we're living in warm, dry, healthy homes. That's great. There's so much to do. We've got to close the gap. I think that's a realistic expectation. I think we can science the shit out of this and get it done. And, we're not going to give up. We're not going to go away.
So you're saying we're not going to go away, and yet we've seen a raft of resignations since the new government came into power and took a scythe to health services. So how do we do that and try and rebuild when we've had so many people leave the system just in the last 18 months?
Yeah, I think with every tide that goes out, the tide is going to have to come back in. There has to be some sensibility that's going to return to our sector and some ethical behaviour. Some return to what really I think most New Zealanders actually want. They want to do what's right. Nobody really wants to turn up and do a stink job and be racist in any way or do anything like that, generally speaking. So if we can hold on to that aroha that is out there amongst all of us, and actually many, I think, New Zealanders do know what we need to do. It's not the political environment right now to be too vocal about that, but I would just really encourage us all to stay strong and to stay keeping our hearts what we know is the right thing to do.
And in Taupapaki, there seems to be a lot of responsibility now on iwi Māori partnership boards. I don't know if I can ask Rawiri this because he's the global director of one, but there seems to be a lot of responsibility on them to fill the quote-unquote gaps that we were talking about before.
Yeah, and I think we need to be really careful, and I want to mihi to all the iwi Māori partnership boards. They're still getting themselves together. They're still only really newly legislated under the Pāiora Act. And they're sort of still in creation mode and trying to get on top of what their mandated actions are, which includes monitoring Te Whatu Ora, but actually having probably quite limited ability to actually tell Te Whatu Ora what to do, but they've got a monitoring role. They're needing help from Te Whatu Ora to give them data, etc. And so we're still in the building and putting it together. My caution is that you want to get stuff out to the local regions, we want to have local solutions, but you can't pass the buck on everything for Māori health to the local regions, because some issues are centralised and that needs central responses.
And I want to get your view, Rawiri, very quickly, but whānau ora decisions have been made which supposedly are going to help that enable that greater community voice on local-led solutions. Do you agree that that's going to be the case?
Well, whānau ora, I think, has been a really strong success, and partly because you want to have community-based organisations understanding the need that's in a community and then addressing that need. So, long may that continue. That's a really important thing. I don't understand what's happened with the tender and, what's happened to the providers, but whānau ora as a concept, whānau ora as a system of delivery to our people, that's really important.
Thank you very much for your time. I really, really appreciate your expertise and time.